Καλησπέρα σε όλους. Good afternoon to everybody. I'm very glad that you're here after a long 2 days summit, and you can approach closer. As you see, we have changed our setup to make it more friendly for everybody to participate. What this session is about is more or less to just discuss a little bit what THR organizations that are supporting this summit and SCOHRE can do together. As a SCOHRE, we have tried, well, first of all, for all those who do not know the details about SCOHRE, is that SCOHRE was created out of this summit. This summit started about 5 years ago by two professors of toxicology and biochemistry who were interested very much in tobacco harm reduction, but more or less on the toxicology and biochemistry of it all. And then that summit was joined by clinicians. And Professor Ikonomidis, who conducts research on innovative products, I will just make them, whole. And Professor Barbuni, who is epidemiologist and public health and professor in public health, is very much interested and has conducted research on the epidemiology of smoking. Got interested. And after that, we just realized that this summit could do something more than meet once a year. And 22 people from 17 countries around the world, during the third year of the summit, decided to establish this Tobacco Harm Reduction and Smoking Control Association with the scope to advocate for tobacco harm reduction. And not only that, talk about science, about policy, about the freedom and autonomy of citizens, and bring the discussion on tobacco harm reduction higher in the agenda of politicians and regulatory authorities. And we had the pandemic, and the previous 2 years, our summit was conducted virtually, online. And this is the first summit that we have after 3 years. Now, in the meantime, after we established SCOHRE, we were invited by DG Santé. For those who are not in Europe, DG Santé is a body of the European Commission that to a big extent, dictates or studies the policies of health in Europe, to align policies between countries. And in that gathering, which was virtual, SCOHRE had a 5-minute slot to state its vision and to state the things it aspires to do. And in that same session, other THR organizations and consumer organizations and users of alternative products were invited. And of course, that in terms of impact, this was not very important for the European Commission. They just wanted us to be there and state what we have to say, but not really, for the time being, not taking very seriously what we had to say. And then we had this summit coming, and we thought that it would be a good opportunity for us to meet either physically, face-to-face, or online, because some of those organizations are in places very far from Athens, and discuss our vision as harm reduction organizations, the things we aspire to do, and discuss how can we together push forward the agenda of tobacco harm reduction? I find, I'm a biologist by training and a PhD in neurophysiology, but not much on tobacco. However, I'm a communication expert for many years. I work for scientific communication, and I find this summit a very important meeting because many people from around the globe said very serious things. And these things can really be incorporated in the public health agendas of many nations. So after this introduction, I would like to introduce you the harm reduction organizations that are together with us. Some are physically in this room, and some are distantly, remotely connected. And we have Manuel Pais-Clemente from Portugal. Manuel, can you hear us?
Hear you. Yes, very well.
Hi, I'm going to give you, the word in a while, but I would like to introduce all our speakers today and also declare that everybody in this room is an equal contributor to this discussion. So after the THR organizations and our experts or whoever wants to have a go with their statements, you are all invited to contribute. I also have Tom Gleeson from the International Network of Nicotine Consumer Organizations, which is an international partner. We have Emil, who is in this room, or he's coming shortly, he's with us, from Hungary. We have Fernández Bueno from Spain, who is also connected online. Dear Amaliya, who has contributed the past few days during the works of this session. We have Alexandro from Brazil. We have Fares from Tunisia. Emil, I just mentioned your name, but you will be talking. And we have all of you who can contribute. Of course, next to me is Solomon, who is also a rapporteur, and he's one of the people who just joined our effort from years back, and he's one of the founding members of SCOHRE. And of course, Ignatius Ikonomidis, who is our president of SCOHRE, and he has done a tremendous job locally in Greece to promote the agenda of tobacco harm reduction. I would like to just ask Manuel to just take the floor. I have to state that Manuel is from Portugal, and he's an advocate and of tobacco harm reduction, and he has been in this gorgeous place 5 years back in our first summit. Manuel, you have the floor.
Thank you very much, Mr. Dear Moderator and dear participants. I'm honored to represent the European Medical Association, EMA, which is an independent non-profit organization located in Brussels, Belgium, created in 1990 by and for the doctors of the European member states, with multiple partnerships dedicated to improve the quality of health care and medical conditions in the European Union. As a member of the executive board of EMA, the most important philosophy of this organization is the following statement: better informed doctors make better treated patients, which is a landmark of all my medical career for the past 50 years. With that in mind, I also have been following SCOHRE since the first hours and its goals based on scientific evidence and efficacy of harm reduction risk behaviors, saving lives and helping people. Harm reduction, as it happens with other medical conditions that we have discussed before, like alcohol, drugs, AIDS, seat belts, and so on, is a concept that needs an universal consensus related with smoking that should be a complementary policy to smoke prevention and cessation. With my medical knowledge and experience, I have stated before that harm reduction come to stay, particularly in those members who are not able to quit smoking even after many attempts of adequate behavioral and medical therapy. We should not abandon these smokers to their destiny, but look for alternatives like novel and emerging products, in particular heated tobacco products. Everybody knows that novel products are the result of progress of tobacco smoking during the last decades, which were originated in China at the beginning of this century with the e-cigarettes and later on with heated tobacco products, also known as modified risk tobacco products. Concerning tobacco smoking, we should keep in mind the basic, this is a principle, the basic principle of physics. The combustion of tobacco with surrounding paper, traditional cigarettes, emits a great quantity of toxic pollutants, harmful for the human body, that may cause cancer, compared with the decrease of toxicity of heated tobacco products, which are not free of risks. Therefore, they should not be considered the same as you have heard this afternoon and all these sections, to the consumers and to the public in general, in order to establish a distinction among these new products. Also, the politicians should be informed about the developments and technology innovations of smoking in order to take the most correct decisions, legal measures, and policy recommendations. Smokers should be at the core of our solutions, as we physicians should place our patients at the core of our actions. Consequently, politicians and regulators should follow these guidelines, making choices based on scientific evidence to improve public health. Like the IMA principle that I just talked about, smoking should have better informed people and better options to reduce the harm of these risks, particularly for the consumers who cannot quit, although the best approach is never, never smoking. In my opinion, this is possible. It is the way of the future. It is in our hands to build up the construction of modern societies with new and safer alternatives to traditional cigarette smoking for people's satisfaction, promoting a new strategy at the governmental level of different countries, led by international organization that has demonstrated capacity of leadership like SCOHRE has shown. Those are my comments related with this matter.
Okay.
But the others would be most pleased to hear other options and listen to the representatives of the organization listed in this program. This is what I have to say, Mr. Moderator, and I'm listening to the other colleagues.
Thank you very much, Manuel. I will keep a few things from what you said. First of all, you represent European Medical Association. This is a very large organization of medical professionals. And if the Medical Association can align the agenda on harm reduction, the impact could be great. But we will come back to you. I have to apologize to Tom Gleeson because I made a mistake. He's representing the European Tobacco Harm Reduction Advocates, ETHRA, and I'm very sorry for that. I just, if you are with us, please, please take the mic, take the floor.
Hello.
Hi.
How are you? Yeah, I'm actually a trustee with the New Nicotine Alliance in Ireland, but I'm here representing ETHRA. We're
That's
one
good.
of the partners in ETHRA. ETHRA are a pan-European advocacy group. There are 25 organizations across 17 countries. We represent approximately, and it is approximate because it's very hard to get accurate figures on the amount of users, but it's approximately 27 million users across the EU. That's a huge number of people. Our mission is to promote reduced risk products and to keep them as accessible as possible. We want to keep the users front and center of all policy. We're the primary stakeholders in any regulation. While uptake by non-users should be discouraged, that should not be at the expense of adult users who benefit from these products. We work with the regulators. Being a pan-European organization, that gives us some standing in EU discussions. We've contributed to the TPD discussions, the taxation discussions, and we're invited to DG Sante's meeting on smokeless tobacco products and their position in the market. We contributed to the Becca report, and that probably had our biggest success, small as it was. But we did get a recognition that vaping products can help smokers quit. And we also got it written into it that reduced products should be evaluated against combustible products. That's very important. It casts the SCHEER report down a peg, as that was tasked with evaluating e-cigs against non-use, against fresh air. Now, we're not against the absolute harm of e-cigs being evaluated, but when it comes to regulation, these products are substitutes for combustible tobacco. That's the comparison that needs to be always primary.
Tom, sorry. Please complete.
Yeah, our main challenges are our enemies, our opposition is well-funded and coordinated. They're not restricted to the EU, they operate globally. And we have lost a lot of our initiative and social capital, probably due to lockdown, but also due to complacency, as the TPD has been such a successful regulation of the vaping market. That's a bit of a pity. Yeah, you wanted to ask something?
Thank you. No, I wanted to stress, actually, Manuel before talked about how important it is for medical doctors to be well informed to guide their patients. And we talk here, you talk here about also the consumers. And this is an issue that was brought up many times during the discussions the last 2 days, how well informed patients, of course, also, but also citizens who smoke, they should be informed, they should get all the right information about all the products that are there. So there shouldn't be any barriers on the flow of information. But at the same time, you also raise an issue, and the same issue was raised several times during our discussions, that we need data, and we need data on the comparative risks of the combustible cigarettes and the other innovative products. And this is one action point that I would like to just put forward for us to discuss later, that we need to advocate for large-scale observational comparative studies or even prospective studies. And we have many scientists around us that could really help to come up with effective, foolproof methodology to just do that in large scales in many countries. I will come then to Charles Gardner. Sorry, I missed, I made a mistake here about who represents the International Network of Nicotine Consumer Organizations. Charles has been with us last year in our online event, and welcome. We would have liked you to be here in our beautiful venue, but hopefully we may have you next year. So the floor is yours.
Oh, I'm so happy to be here. Thank you very much. Greece is one of my favorite cities in the world, so I will find any excuse to travel there. My name is Charles Gardner. I'm the executive director of INNCO. INNCO is a nonprofit organization. We have 37 member organizations all over the world. Our membership is growing fastest in Latin America and Africa now, but we work very closely with ETHRA, so Tom is a good friend, and we have members in Asia and so on. And the goal or the mission is to support the rights of 112 million adults who use safer nicotine to avoid toxic forms of tobacco. It's that simple. And so we're very interested in meetings of this kind. We love the existence of SCOHRE. I have a couple of messages for SCOHRE. One is that we do work with researchers. I'm a developmental neurobiologist by training, so have some experience in research. And we have an open door policy to researchers to help you recruit patients for clinical trials. At the same time, we would strongly recommend the creation of good research practices in this field. So as Tom was saying, we don't have studies that only look at vapor in, alone, but actually have to make the comparison to cigarette smoking and to ambient air, right? And not to make sweeping claims from the, petri dishes and from studies in mice. And I think SCOHRE also has a powerful potential role to play in the development of curriculums for continuing medical education and for medical schools. So these are neglected areas right now, big time. And so I'm going to keep my remarks very short, but I'm going to try to be provocative and blunt and say the following. This is just logical. There are safer nicotine alternatives to deadly cigarettes and other toxic forms of tobacco. Not encouraging adult smokers and users of these other toxic forms of tobacco, not encouraging them to shift to safer nicotine alternatives is negligent homicide. It's not like negligent homicide, it's not similar to, it is negligent homicide. And taxing and banning them is mass murder. And I think we need to start to frame this in terms that history will see it this way. So thank you.
Thank you, Charles, very much. I mean, your last point, although your language was very, very tough, is very well put. And earlier today, David Swainer, in a panel, just brought up in a different language this issue, that many years back, we sued tobacco industry because they didn't inform appropriately smokers about the risks in their life. And now what do we have? We have authorities, governments, that really prohibit the flow of information about the less harmful or potentially less harmful products. So in that respect, you're absolutely right. And I think most of us in this room really follow your thinking. Thank you, and we'll come back. You put some issues, though, that are for discussion. Continual medical education. We have to just update the curricula in medical schools, professors year-round, and let our students know more about those new innovative products. But also we need to have very strong methodology of how we conduct our research. And sometimes, you know, when I discuss with people, they say, well, you know, we shouldn't really leave the industry to dictate the methodology. And I say, yes, okay, so let's do that together. Let's collaborate with industry because they have the money and they do the research for their own products. And let the scientific community must have an influence so that methodology is rigorous and state-of-the-art. And this is also something that organizations like ours should put forward. I can ask now Emil. He's, you know, amongst us, and to take the microphone and tell us about your organization.
Thank you. I came from Hungary, and I have a post-COVID, so sometimes I'm coughing. I'm sorry about it. Actually, in the last year, we started to make some training programs in the nurse schools. It's university level. It's a regular-based program about harm reduction because it was the first step how we can go into the university system. And we started a program. We are there in each medical society regular meeting, and we are making some harm reduction informations in some way, presentations or to be there. That was the last year mainly. We had an awareness campaign because in Hungary there was the ETHRA was very came in the black market into the society. The target group was mainly from the 8 to 15 years old children, and we started a quite successful campaign. So that was a legislation at the end from the state. So we are trying to give the society the idea what the meaning of the harm reduction is. When 20 years ago or 15 years ago we started the hospice movement, the first problem was nobody understand what the hospice is meaning. And now it's the same with the harm reduction. So we are trying to tell to the society what is the harm reduction meaning. So we are in this level in this moment. Thank you.
Thank you very much, Emil. I mean, harm reduction, we all know it when we put a sunscreen, cream to avoid melanoma. Or as Konstantinos Varsalinos said earlier today, when we put our seatbelt. But when it comes to tobacco, it becomes confused. And I think Redmond put it very well in the panel earlier today. I will now come to Fernando. Fernando, are you with us? Fernández Bueno is a founding member of SCOHRE, and he has been with us in all summits, well, virtually the last 2 years, and this one, but hopefully next year we'll have him face-to-face, or we may meet in Brussels if we manage to organize, a meeting within the European Parliament to advocate for harm reduction. The floor is yours.
Thank you very much, everybody, and good afternoon to all the panelists. In Spain, the treatment against tobacco use has been focused on an approach that has proved to be insufficient and leaves all those not choosing this path without support options. In this regard, health authorities have not put forward other options or innovative measures to enable the smokers with the greatest difficulties to be able to reduce tobacco harm. The discouraging figures for the prevalence of tobacco use recently published by the Ministry of Health is 34% of adults aged between 18 to 64 years show a model that is exhausted and make it imperative to change the status quo and a more modern and realistic view on how to address the problem of tobacco use and its effects on public health, taking into account the evolution of social expectation and technological advances. While we unequivocally share the objectives of our fellow authorities and other organizations involved in the fight against tobacco use towards an ideal of zero consumption, child protection, about new consumers at all cost, awareness, raising campaigns, compliance with the regulation and promotion of quitting, we believe that Spain must have a more ambitious approach and take a step further in the fight against tobacco. Therefore, the Platform for Tobacco Harm Reduction in Spain is an initiative comprising of doctors, professors, healthcare professionals, and independent scientists committed to public health, propose a guiding principles with measures that would help to more effectively reduce the harm and disease associated with tobacco use in Spain. And we have 10 points, but I think the three betters of them is the first one is implement public anti-tobacco programs that integrate policies and tools for reducing harm. The second was to encourage communication and research on low-risk products and their impact of the prevalence of tobacco use. And the third one is health authorities should provide objectives and scientifically validated public information about the difference between combustion cigarettes and the low-risk products. And that is what we think in Spain, that is what we are fighting, and this is our rules and what we want to do next year in Spain if public authorities let us to do it.
Thank you very much, Fernando. I mean, one of the things that really we all share, all the harm reduction organizations who are represented here, but also the expert, is that we have a common agenda. Having gone through, the description of all those harm organizations, I couldn't find any differences really. They all want the public to be better informed. They all want the doctors to be better informed. They all want regulatory authorities to assume harm reduction as a pillar for public health to complement the strategies. So our agenda is common. What we have to do is to work on common messages and on common actions. And although in each country, the communication campaigns to the public can be, of course, according to the culture and to the environment, when it goes to education of professionals and research, we have to have common protocols. I would like to ask Amaliya to just tell us about the Indonesian Free Coalition KABAR.
Thank you very much for the opportunity. I also have slides to be displayed, please.
Okay, they're there.
So, I'm Amaliya, I'm a dentist, and I work as a lecturer and researcher in dental faculty, Universitas Pajajaran, Indonesia. But today I also represent KABAR. KABAR stands for Koalisi Indonesia Bebas Tar, or Indonesian Tar-Free Coalition. So I would like to show you what is KABAR. The profile of KABAR is an alliance comprises of association and organization in the health sector that focus on reducing the dangers of tobacco or tobacco harm reduction and reducing health risks due to smoking. And this coalition is also focuses on efforts and find solution to reduce health risk caused by smoking, one of which is through alternative tobacco products. And we know that Indonesians have a largest prevalence or number of smokers. It's about 1 out of 5 people
20%.
smokers. So about 65 millions of population are smokers. So it would be very huge problems in Indonesia. And KABAR has actively carried out various initiatives to educate the public about the dangers of tar from tobacco combustible products. And we educate communities, and we have also done roadshow to various cities around Java. I hope that it will be for Indonesia. And also we have an online information or platform. The website is koalisibebastar.com and social media. And maybe we can skip it. The implementation of harm reduction of KABAR is also to educate people like Lina and Farsalino said that helmet, electric car, sugar, reducing in sugar and salt consumption, caffeine, renewable energy, recycled plastic, and also alternative tobacco products. And we also have carried out direct advocacy with Indonesian government bodies and focus group discussion, public discussion, and other events, media advocacy, as well as research collaboration and scientific engagement, and also participation in policy making with government. We already have a collaboration that I am proud of this milestone of KABAR. Firstly, we have a risk assessment of aerosol chemistry and content. This is the collaboration of KABAR with Dental Faculty, Universitas Padjadjaran, and Skylab in Greece, in Athens, with Farsalinus. We have a quantitative and qualitative analysis of illiquid and heated tobacco products. And also, we have a collaboration with KABAR in Catania, with Professor Polosa. The project of replica and smart study, it's an ongoing project in Indonesia. And also we had the systematic review showing the efficacy and safety profile of alternative tobacco products and nicotine products for smoking reduction and cessation. And it is proven by this systematic review that it is effective and can be a potential smoking reducing aid. Okay, but then we have also challenges and opportunities that the resistance and lack of understanding about tobacco harm reduction or TAR versus nicotine, as well in the implementation of the studies and research. We in Indonesia, all of them, consider the paradigm of zero risk, not less risk. And this causes limited studies and research on tobacco harm reduction. And also, we have a lot of resistances from medical staff because they are rely on WHO and tobacco control group stance on the tobacco harm reduction, and they are so stubborn. They don't want to consider any body of evidences that abundant. Even they said that you have to carry out the research in Indonesia, not to believe a lot of body of evidence from outside. So we carry out a lot of research and studies in Indonesia, but still it is not enough. It is not enough to convince the government. That's the very, very big challenges for us. But we also have the opportunities to provide the government with studies and research on tobacco harm reduction in order to overcome the smoking epidemic and providing public with scientific findings that I already mentioned. And so we would like to create awareness and understanding of the difference between nicotine and tar, as well as the different risk factor between cigarettes and alternative tobacco products. And we already building collaboration with researchers, academicians, and advocates to support tobacco harm reduction concept and implementation in Indonesia. That's what I'm happy. And well, this is committed to providing education and information through various communication and about the dangers of smoking, prevention of underage access. So we prevent youths or teenagers to have access to these alternative tobacco products. And we would like to aim at finding the best solution to reduce smoking prevalence in Indonesia. Thank you.
Thank you very much, Amaliya. I mean, I will keep what you said that about the WHO agenda being imposed on Indonesia. This is something that we meet in many, many countries. And even here in Greece, when we started, doctors, especially pulmonologists, were extremely suspicious. And because there is a regulation that if they advocate for THR, they are banned out of their association, they don't even want to join our, our meetings. So we know how WHO works and that the zero risk is very known to all of us. And it's not, by accident that we gave the name SCOHRE, which is Smoking Control and Harm Reduction. Because, of course, we advocate for smoking control and cessation and prevention. But unfortunately, this has gone on for so many years now, and we just still see, the number of smokers growing. But thank you very much, Amaliya. And the things you said, that most of the challenges that we face differ, but they are common in many ways. And one of the things that we should do as a network, organizations, is to share practices. If something works in one country, there's a high likelihood that it may work in another. It's not a guarantee, but the likelihood is higher. And I will go from Indonesia to Brazil. Alexandro Lucian is a friend of SCOHRE. He joined our summit last year. We haven't met yet in person, but he was introduced to us by Monica Gorgulho, who is a psychologist and a founding member of SCOHRE in Brazil. And they do a great job in that part of the world, which is far away, but it's in an absolutely gorgeous country. Alexander, you have the floor.
Thank you, Lina, very much. It's a pleasure and an honor to be here. Hello, everyone. My name is Alexandre Lucian. I am president of DIRETA, which stands for Directory of Information for Tobacco Harm Reduction. It's an organization created to represent consumers of nicotine in Brazil and to share information about THR as a strategy to reduce the impact of smoking. DIRETA was formed by a group of specialists in pneumology, psychiatry, toxicology, and harm reduction. I was chosen to lead mainly because I am a consumer who in 2015 found in electronic cigarettes the only way to stop smoking 3 packs a day, every day, after 15 years of smoking, which I believe saved my life. So I became a journalist specialized in THR. DIRETA believes in the use of classic methods to stop smoking, such as abstinence, nicotine patches, chewing gums, and medicines. But we do not ignore the world evidence that has found in products like vaping, oral, and heated tobacco an effective alternative to combustion cigarettes. We are inspired by examples such as United Kingdom, New Zealand, and many other countries that have had positive results in the use of THR. While we realize what has happened with countries that do not regulate or prohibited the products, getting negative results such as the use by minors or non-smokers, illegal products, and lack of market control. In Brazil, since 2009, the sales, importation, and advertising of products such as electronic cigarettes have been prohibited. Despite this, it was never forbidden to have or to use an electronic cigarette. So, after 13 years, this option proved to be ineffective, where recent data show a vaping prevalence of 7.3% of adults, totaling more than 10 million consumers who have access to products without any sanitary control or quality assurance that enter our country through illegal means and are sold everywhere, from tobacco shops to gas stations. Brazil is experiencing a sanitary scandal dominated by hostility and distrust towards vaping due to an immoral campaign coordinated by health organizations with big financial support by foreign capital, which by ideology or self-interest, I don't know, has contaminated legislators and the public opinion by spreading misinformation and disinformation. In Brazil, most doctors, along with the general population, believe that vaping is as harmful or even more harmful than conventional cigarettes, where the media share incorrect information or biased data, which contributes to the lack of regulation of the products in Brazil. DIRETA is a very small institution created to try to change that, working exclusively with volunteers, which even without investment from companies or the government, has already made important contributions to the debate of THR. Through lectures, events, constant contact with society and consumers, working with the media to try to correct things. Recently, we contributed to our government's regulatory process, which opened discussions on the current legislation on vaping in Brazil. We presented a 78-page technical document with a critique to the report delivered by Anvisa, which is our regulatory agency. It was absolutely ignored science and chose to not regulate sales, keeping the ban and maintaining the illegal market. I think we can all agree that vaping is not 100% safe, but it's much less harmful than smoking. But remember, this conclusion can only be made in regulated markets, such as the UK, where you control the chain of production, the quality of the products, and especially have an informed society. In Brazil, our government's prohibitionist approach makes vaping much more dangerous than it should be, preserving an illegal market that offers products without any guarantee of quality and safety. So in a hostile environment to vaping, our power lies in information without bias or self-interest, grounded in science and truth. It is a difficult task to paddle against the tide, but we believe that science cannot be denied forever. We continue to seek investments and partnerships to support our work, planning new events and sharing quality scientific information to inform consumers, legislators, and to improve the debate and perception about THR in Brazil. So I put myself and DIRETA at your disposal and ask for everyone's collaboration and support so we can have a better scenario in our country and also help others to do the same. Thank you.
Thank you very much, Alexander. You brought some issues that have been discussed during the 2 days. Misinformation, disinformation, disorientation, lack of regulation. I mean, Brazil suffers quite a lot because what you brought up about the misinformation about vaping is very important. And we also talked about frameworks and regulation. If there is no regulation, you have nothing. So if we can help, or our experts can help, we can do that. I mean, the whole discussion today and the next discussion that will follow through emails and networking, etc., is on that, to just provide support and seek support. So it is a network that will support each other and create value for the end user, the consumer, and our systems. And I will ask, next to me I have Ignatios Ikonomidis and also Fares. Fares Mili is also a member of the board of SCOHRE, and I would like him to introduce the Tunisian Society of Tabacology. And then we will have our president after I give you the floor. The floor is yours.
Thank you very much. I'm Fares Mili. I'm basically pulmonologist and then addictologist and certified tobacco treatment practice. I'm the chairman of the Tunisian Society of Tabacology and Addictive Behaviors. It's called STTACA. It was created in 2017. As you know, smoking cessation involves pharmacotherapy and counseling in smokers motivated to quit. Cognitive behavioral therapies are the powerful therapy used in this field. The practical approach about cognitive behavioral therapies in addictive behaviors must be applied in tabacology. That's why our main objective was to reorienting tabacology towards addiction in the main, and it's the main objective of the STTACA, since smoking is an addictive behavior. Our activities, and those are those of any medical association, training of healthcare providers in smoking cessation and prevention of addictive behaviors, spreading scientific evidences about tobacco harm reduction, research in tabacology and addictology. We have organized several workshops relating to the management of psycho-behavioral and emotional tobacco addiction, stress management, assertiveness, emotional management, etc. We have also disseminated evidence regarding the risk of efficacy of no-smoke nicotine delivery systems. We also have networking activities with our international partners, like SCOHRE, to promote tobacco harm reduction strategies. We had participated in various summits and meetings about tobacco harm reduction. We had been accredited in 2018 by the United Nations as NGO to participate in the United Nations high-level meeting on the prevention and control of non-communicable disease. And we had also been a signatory of the data from 72 specialists in nicotine science policy and practice sent to the Director General of WHO to express our hope that WHO will assume a leadership role in promoting effective and fast-acting policies for regulating tobacco and nicotine and to adopt innovative reduced-risk products. We had also been a signatory of the data from 100 specialists in nicotine science policy and practice to head of delegation parties of the Framework Convention on Tobacco Control in November 2021, to urge parties to the FCTC to encourage WHO to support and promote the inclusion of tobacco harm reduction in the framework of tobacco Framework Convention on Tobacco Control. And we worked hardly to make no-smoke tobacco products banned in Tunisia. And we succeed, and now e-cigarettes and heated tobacco are regulated and are on the market.
Well done. This is important.
Now, our main project, actually, we are going on is the elaboration of the Tunisian guideline on tobacco addiction, involving several scientific societies and experts. And we are adapting the NICE, the UK guidance on tobacco dependence. We aim to finalize this project by next December, and it will be labelized by our National Institute of Accreditation in Health in compliance with their guidelines.
Thank you very much. Thank you, Fares. I mean, you do a great job, and if we had such organizations in every country and so active, we would see results, sooner. Ignatie.
I would like, first of all, to thank you all that you have joined this panel, all the organizations, and I'm very happy to hear that we can join forces. We can do networking on common targets, and of course the main target is health, and to keep healthy and to promote health in our countries. I would like to present some practical tasks that we accomplished here in Greece. For example, as Lina said, our title is Smoking Control and Harm Reduction, because we think that smoking cessation and harm reduction go hand by hand and side by side. And there are two tasks, at least scientifically, and of course politically in terms of public health, that have to be pursued. Now, I'm a cardiologist. I run a preventive cardiology department, and we have a smoking cessation clinic, and we do a lot of effort to stop smoking in our coronary artery disease patients and our cardiac patients. And we have seen data that despite our proposal, despite counseling, there are a lot of relapses. Also, we used all pharmacotherapies, and again, despite being effective the first 3 or 6 months, there are a lot of relapses. So we have seen these people deciding for themselves to use these novel smoking products. And we said, okay, let's check ourselves what is the effect on the vascular bed, on cardiac function using surrogate markers of these electronic cigarettes and heated not burn products, because we wanted to have our own experience, and we published this experience. And of course, the harm reduction is present. We heard, this is a very nice expression, the zero risk that the WHO and the European Respiratory Medicine supports, because they want to compare these products with fresh air. Even air is not fresh, it's polluted. So again, the comparisons are not perfect. What we did as a practical approach is first to inform our cardiology fellows for smoking cessation. What we did is we did some workshops presenting how to approach smoking cessation and to discuss about the novel smoking products, because as the previous speaker said, doctors should be informed, and they are lacking this information, and they asked us as university doctors to present to general practitioners, to general cardiologists, this knowledge, because patients come to their offices and ask, are they harmful? Can I use them? And they did not know about it. They didn't know the science behind it. Of course, the science, as the previous speaker said, is that there is less risk, but there's still some risk, and we don't have any long-term studies to show us what this 1%, we know that there is 99% less toxic, but what happens with this 1%? Is it toxic in 10 years? So we need to present all data so that the doctors are informed, and patients and subjects and smokers to be informed about it, so they can make their decisions according to the current data. And this is something that we have also, there is need to inform the politicians. Last year, for example, in our last summit, we had a day before the summit, a workshop discussing all of it in a totalitarian manner, discussing cessation and discussing the novel smoking products. That's why I say we should discuss about it as an overall approach as medical community. What we did the last 2 years is to organize workshops within the Hellenic Cardiac Society, training workshops for general practitioners and cardiologists, how to approach smoking cessation, what are the pharmacotherapies, what are the approaches, and of course discuss again about the novel smoking products, the pros and cons, the data supporting these harm reduction policies, but also data against that. So they have a global knowledge about the current data. This is something that we carried on to introduce SCOHRE through these workshops, through Hellenic Cardiac Society and through this training. And we already have done a training about 80 cardiologists and general practitioners. The other thing that we do during the COVID era is to join our forces with psychiatrists and psychologists and do Zoom links, Zoom behavioral sessions. Again, there we present data on smoking cessation, about pharmacotherapy and novel smoking products to inform now the subjects or people that want to stop smoking or change their smoking habits to know again the risks, the pros and the cons. So I think by this way we made our effort to increase awareness about novel smoking products and harm reduction. Now, in policy making here in Greece, there were some changes because the government permitted the creation of a committee where the industry can pose claims about their products. Claims that if they are reduced risk or if they are reduced exposure, something similar to the FDA committees. And I know that the industry has proposed their claims and we are waiting for the committee to give approval to those claims, all of them or part of them. So this is another, I think, another option that every one of us should pursue to push for legislatory bodies and the regulatory bodies that was asked, for example, in Brazil, such bodies should be formed to check the quality of the circulating products, the novel products. Some of them, because they come from industry like the heated, not burned products, are checked. We know their quality. Some others, like the liquids from the cigarettes, are not known. And I think that the creation of capsules with certain amount and certain ingredients and certain amount of nicotine is needed, at least in Europe. And there should be a regulation about it. These are at the moment our targets and our tasks, trying to network with you and to organize the need that you posed. Information for medical doctors, information for politicians, information for public health people that are involved in public health, and information, of course, for the general public because they want to know about it more. And with this, I would like to conclude and ask our rapporteur probably to make a summary of our comments.
I would like to just make a comment before I ask Solomon to just wrap up what we have so far and give the floor to others to contribute. One of the things that we face altogether when we talk about innovative product is that their results are short-term. We don't have data. The data we have are for 6 months, for, 12 months, with small numbers. And this is, of course, true. On the other hand, we have obstacles to create more data. So one of the things that we need to push forward is more academic freedom to generate data and more comparative studies so that in 5 years we have more robust data to analyze. And of course, this is an action point for us: education for professionals, for the public, for regulators and policymakers, for the press, because they're so important to disseminate this information, but at the same time build robust protocols of studies. Solomon, you have the floor.
I think before I summarize, it would be very important to have at least two people from the audience just to say, take a minute to share with us what you have in mind in the different countries. I don't want to put you on the spot, but you may want to start. 1 minute.
I mean, who would like to share thoughts?
She is going to do so.
Okay.
But 1 minute.
Thank you so much. First of all, thank you to the organizing committee for this great meeting and this panel in particular. So I was hearing you, and apparently there is this big gap between the information that arises from the science and the foundation for the political decisions, education, etc. So, which of course jeopardize the benefits that could arise from the science. So, what do you think, or why do you think that happens? The science results are not clear enough. So we have to improve even more science communication, promote scientific literacy of the population, including politicians. Or so maybe we are missing the implementation of a moralistic projects that could include clinicians, scientists, communication, media, decision, responsibility, stakeholders, of course, in the process. And what do you think about in each country to include a survey for the toxic products in urine of consumers, for example, like a screening, a global?
But I think we can leave it there. We get it.
Yes, I would just conclude, so maybe I'm dreaming too high, but I would like just to think that it is possible, and just your comment, please. Thank you.
Yeah. Just one more contribution. Thanks. The gentleman over there. We may not be able to respond to the questions now because we are summarizing, but I think the questions are noted. They'll be included in the summary. Yes.
Okay, thank you very much. I'm Daryon Hadi from School of Pharmacy, Bandung Institute of Technology, Indonesia. This is the first time I joined this summit, and it is a really great summit with many experts share to us. So just as told by all speakers in this today's summit, that all experts told us that combustible tobacco causes cancer, cardiovascular disease, and others. So I hope the government in all countries in the world should promote, support, and endorse smokers to others more safer tobacco products or other nicotine products and so on. So we hope that in these cases, I think that all countries has the challenge for giving incentive to less harmful tobacco products. And moreover, I also think that for the target of healthy people, hopefully that all government will set up regulations for prevention as well as for smoking cessations. Thank you.
Thank you very much. I think really in summary, a few trends have come out. The first trend has to do with research. We obviously need to know more about the problems of combustible tobacco. and how the alternative products are going to improve health of people. That research is very important, and it seems as though we are not communicating this information in a manner that many governments accept it and go along with us. If you notice, many of the medical wards are full of people with problems related to chronic use of tobacco and maybe alcohol too, chronic lung diseases, cardiovascular problems, and when you take history, there's smoking there. The second trend that comes up is that we have to be advocates of tobacco harm reduction. This process cannot grow without us teaching people, the ordinary person, the so-called educated people. Sometimes they don't know because they are listening to what their brain wants more than the knowledge of what nicotine does to the brain or what the combustible cigarette does. I think we need to also, what's coming up is the need to introduce educational programs at universities so that students of all categories can understand these things because they are already learning and they can share this information with their families. So we're talking about medical schools and other schools. We've got to engage government. This is another trend. We've got to find ways of engaging government without antagonizing government. Because if you antagonize government, you will not get financial support to do research. When we started here, we were just talking about how easy it would be to do research on these novel products in South Africa. And I said, you know, maybe through Medical Research Council, but my government has not yet eased up to these products. Therefore, getting permission, approval for a particular research project might be difficult. However, if we engage and we use the existing institutions, that may be easier. I'm glad that there are first-timers who also see the opportunity for further engagement and further education. But we need to support each other. I think what we are really saying is that there must be hard, robust data. So we must try and find ways of getting involved in research and sharing in different specialties. We have cardiology, we have pulmonology, we have neurology, we have so many other specialties. Psychiatry is my specialty. We have to find ways of doing research there, which is very difficult because mentally ill patients cannot easily make decisions for themselves, but we can observe certain things, we can document them. So overall, these are the key trends that came out, and just want to thank the president here for opening the conference and then also giving us a summary of the trends here in Greece. From what he said, clearly there is a very strong engagement in understanding biochemistry, toxicology of these products in different ways here in Greece, and there's also engagement. What is the question that has not been answered throughout the day? And I think Constantino brought it up earlier on. Why do people continue smoking, despite the fact that they know combustible cigarettes might be dangerous? If they know that there's danger, there's something else they need there. Can we give them that in a safer way? This is the way we have to approach this, in talking to governments, that we don't want those people to spend time in hospitals because that is at great cost to government. The last thing I really want to mention, which came from presentations this afternoon, has to do with taxation. Is it logical for governments to tax an approach that wants to improve the health of people higher than the ordinary cigarette that's actually more dangerous? I mean, why is the logic lopsided? Is there a way of engaging governments to understand that there's an intervention that wants to improve health? We would like to improve health rather than destroy lives of people. Let me stop there and hand over to you, Nesha.
Before you conclude, Ignati, I would like to put forward the following. I'm a communications person. Mm-hmm. And we know that for naive people, people who know nothing about it, when you say something that is new to them, is very little understood. Mm-hmm. As you hear more about it, yes, from different perspectives, from different people, that creates a background that the information can be built. That is exactly the same about politicians and regulators.
Yes.
So when you first say something to them, they negate most of the times. When you keep spreading the word and talking about it from different angles, evidence-based, then it will come a moment and they will surprise you. They come to you and they will say, I knew that all the time. And this is what happens with information. We have to just unite our forces in communication, but also in the generation of evidence-based evidence. And that is where we need to unite our forces. And of course, all those professors who are here and who were here, they need to do their job with their students and with their colleagues to try and disseminate the word. And Ignatia, you have the last words, the last few or many words?
No, it will be few. We have to spread the news, but we have also to provide evidence to support the news. And this can be from Cochrane databases. I have presented some of it. 16,000 people from 60 studies. However, they have to be prospective studies. And that's the difficulty, because these studies have to be financially supported. They should not be prevented, as I said, from the various universities and the boards. So in some cases, for example, in my university, they are more open-minded. They approve these projects. In other universities, it's not the case. I also discussed from people from UK, and it's the same situation. Some are more prone to, be engaged to such research. Some other, they just ban it because they don't want to hear about it. And of course, we have a very strong lobby against us, the European respiratory medicine people, that they are very dogmatic. They don't want even to debate about it. That's the contrary with other specialties. We had, for example, in Hellenic Cardiac Society congresses, debates on the pros and cons of the new novel product. At least we discuss and we let the doctors to decide themselves what is right and what is wrong. They don't want to hear it. WHO is also very dogmatic. The zero risk, its motto. So what we need is to network, to keep and to formulate actually a document signed by all these organizations and to circulate it in Europe, in South Africa, in Commonwealth countries, for example, since there are a lot of Commonwealth countries, and to inform by this way both medical doctors and regulatory authorities.
That means, Ignate, that we will start building a document that we will circulate among the organizations, experts, for contributions, so that within, let's say, 2 months, come up with a common document that would be, the advocacy document of this summit.
So, to these few words, I would like to thank you all for participating to that venue, because you gave us new ideas, your expertise from the countries that you live, and we would like to invite you to our next meeting next year. And I hope that those of you that were through the Zoom links that will be here in person to discuss more about smoking cessation, smoking control, harm reduction, and new regulatory policies about them.
We will be in touch with you.
Thank you very much.
Any of our guests online would like to have a last word before we close?
Lena, I would like to just point something out. Can I?
Of course.
2 minutes. I would like to point out about scientific research and the responsibility researchers have from top to bottom. A recent study published by Sebastian Solet and Roberto Sussman from Mexico regarding the review of papers published after 2017 about the potential inhalation of metallic compounds in the aerosol emissions produced by electronic cigarettes identified that all of those studies exhibited experimental failures. For example, the use of high-power products in systems intended for inhalation at low power, causing overheating conditions that favor the production of toxins and generate aerosols that are repellent to human users. So something that cannot be translated to a real consumer. When that happens, those studies end up being cited by doctors from traditional and respected health organizations in Brazil that boosts the misinformation about vaping and make legislatures think that vaping must be banned, and the general population keeps thinking that vaping is worse than cigarettes. Then I have to make a video about the subject on my YouTube channel, and I became the crazy guy pointing out a conspiracy theory. So I think the researchers must be also responsibilized by those studies that have flaws on the methodology, that this kind of things end up harming much more countries like Brazil that have so many difficulties about misinformation and disinformation.
Alexandra, we will join forces and try to provide as much help as possible. Thank you all for joining us, and next time we'll be face-to-face. Cheers.